Good afternoon, and welcome to the ConnectureDRX Voice of the Medicare Consumer Survey results. 2022 was the 11th year of surveying healthcare and Medicare consumers regarding their shopping and buying behaviors. Over the past 4 years, we have surveyed Medicare beneficiaries primarily, with a small subset ages 62 to 64 to get their perceptions of Medicare prior to becoming Medicare eligible. We conduct these surveys every year following AEP. I'm Cara Tarantino, the Director of Marketing with ConnectureDRX. It's my pleasure to present today with Susan Plumer, the Chief Growth Officer at ConnectureDRX. First, a little bit about ConnectureDRX and our theme for the year. 2023 is all about evolution and the journey we are taking with our customers to do better and be better. As our partner or potential partner, we are certainly grateful to include you on this journey. Our new marble design for 23 reflects the strength of our customer relationships, technology, and industry experience, all of which have enabled ConnectureDRX to become the trusted source for all things Medicare and more. And we thank you for joining us on this incredible evolution. Adding the trusted source to our brand came about when we surveyed our customers. Time and again, it was our customers who said they rely on us to be their trusted source for all things Medicare. To uphold our responsibility as the trusted source, we strive to consistently offer the most personalized experience for your agents and members to drive engagement and protect against plan disenrollment. We offer the largest health plan FMO agent distribution network in Medicare called BrokerLink. We have a simple, intuitive platform to shop, quote, enroll, and retain your customers. And our drug pricing transparency delivers the most accurate out-of-pocket estimates for consumers, along with proven medication adherence that helps elevate star ratings. So let's take a moment to look at today's reality regarding Medicare in the senior marketplace. The reality is there are more seniors everywhere. In 7 years, our target senior demographic will double, and in 11 years, seniors will outnumber children. Seniors are breaking senior stereotypes. They have become influencers on social media. Grandma is now a TikTok and Instagram star. 71% of successful videos that come from these senior influencers are about defying age or mocking ageism, and the grandkids are managing their grandparents' social media accounts. 86% of boomers did holiday shopping online. Streaming's on the rise, and self-shopping is disrupting selling. AI, as we know, has entered the chat space, and there's a surge of online enrollment. We need to know how our senior audiences act in all areas of their lives, as everything ties in with their health. And just a few industry trends. Medicare Advantage enrollment has exploded over the past 15 years, increasing by 337% from 2006 to 2022. Traditional or original Medicare has declined by nearly 3%. Out of the 65 million eligible for Medicare, nearly 30 million are enrolled in MA. So with an almost 50% market penetration, MA delivers better services, value, and access to care. And according to AHIP, 93% of Medicare Advantage members are satisfied with their coverage. So Medicare Advantage appears to be the most profitable insurance segment, and health plans are expanding to take advantage of this profitability. What's interesting is MA is still growing, but not at the rate it used to. MA participation grew by 5.5%, adding only 1.5 million beneficiaries. This is down from 9% growth the previous year. Special needs enrollment, or SNP, however, is up 20% this year over 2022, with most of these gains coming from D-SNP enrollments. On the carrier front, United Healthcare accounted for 55% of all new enrollment, whereas in prior years, their new enrollment hovered between 30 and 40%. Humana had 23% of new enrollment. Beneficiaries had access to 43 plan options, up from 24 plans in 2019. And at the county level, competition is declining due to market saturation. 73% of Medicare Advantage beneficiaries are enrolled in plans with 4 or more stars, down from 89% the prior year. So the last slide before we get into our survey, we found quite interesting from a January RISE presentation by Blue Cross. It shows why it's important to engage consumers within the channels they are using the most. 85% of individuals start their purchase process using one device and then they finish on another. 72% of people expect that the companies they're buying from know their customer information, regardless of the method of communication they select. 75% have experienced problems purchasing insurance online, and 42% are likely to switch from their current provider due to a lack of digital capabilities. Omni-channel strategies can close the distance between health plans, insurance agencies, and their agents and members when touch points are relevant and contextual. So now Susan's going to take us through the ConnectureDRX Voice of the Medicare Consumer Survey results for 2022. So take it away, Susan.
Well, thank you, Kara, and good afternoon to all the folks joining us today. We appreciate you. Just a few comments about our methodology. So over the past 11 years, we've actually surveyed nearly 22,000 healthcare consumers. And last year, we conducted a survey of about 1,700 seniors ages 62 and over to understand their habits, their preferences, and behaviors when evaluating and choosing healthcare and or Medicare plans. And for those over 65, we paid really careful attention to the type of Medicare insurance they have, how and where they purchase their plans, how they use agents in selecting a plan, other factors integral to plan selection, reasons for staying with a plan or switching plans, and their overall plan satisfaction. In 2022, 64% of our surveyed population were female and 36% were male. We had more people in the years leading up to Medicare, ages 62 to 64, respond to our survey. That was up 20%, and typically our response in that age group huddled around 10%. So we surmise that more people want a better understanding of their plan options and costs, and they also want to be more informed about Medicare, including deadlines they need to consider. The most respondents we had were ages 65 and 66, which obviously makes sense. And 75% of our respondents were retired and a quarter of them still working. From a health status perspective, 15% self-reported their health as excellent. 41% said they had very good health, and 38% said their health was good. 6% say they are in poor health. So when looking at the type of Medicare plan, this slide actually shows the year-over-year comparison of the type of Medicare plan beneficiaries are enrolled in. And of those we surveyed last year, 69% have only Medicare. They don't have any other health insurance. And looking at the gray bar on the right for 2022, 53% of those surveyed last year have original Medicare, and this is down from a high of 65% of those carrying original Medicare in 2019. 41% have a Medicare Advantage plan, which is no surprise to anyone on this call. And 28% have a PDP plan, 16% have MedSup. This slide pertains to a number of questions we've asked, including, did you purchase a Medicare plan this year? How many plans did you compare before making your decision? And how did you compare the plans? year over year, we see that 58% of beneficiaries purchase a new Medicare plan and 42% of respondents do not purchase new plans, period. The majority of seniors only look at one carrier before deciding on a plan, and 1/3 look at 2 to 3 carriers. More than 80% of seniors will evaluate 1 to 3 plans before making a decision. And for sources of plan comparisons, which I know is very interesting to the folks on the call today, 31% still rely on Medicare.gov to compare plans. 26% will call an agent directly to compare plans. 21% visit with an insurance company or carrier's website, and 20% did not compare plans at all. Agents are still a very critical source for seniors when plan shopping. And here is what is most important to seniors when researching and shopping for insurance. So 30% said calling a broker I trust for advice is most important. 29% said they prefer to shop and enroll online with little assistance. 13% said calling an insurance company or a carrier that I trust directly. And only 9% rely on friends and family for advice. So let's talk a little bit about the older seniors in ages 67 plus. These older seniors use agents more than younger seniors when looking for trusted advice. Not surprising, it's the younger seniors who do most of their own research online. 32% of those age 67 and older turn to agents to get their input versus 25% who shop online with little assistance. 14% of the older seniors call an insurance company or carrier they trust most, and like the slide before, very few look to family and friends for advice. So our year-over-year results for the past 4 years have remained pretty consistent. 46% say that a low monthly premium or zero premium is the most important factor in choosing a plan. 23% say it's keeping their current doctors. 10% want their prescription covered by their plan. And another 10% feel that going with a trusted brand is most important. And 8% want a lower out-of-pocket estimate of every year. So let's break down the data a little further regarding older seniors and best fit plan selections. We see that older seniors are significantly more likely to say that out-of-pocket costs are the key to what makes their plan a best fit. Not only do half of all older seniors say out-of-pockets are most important, they are also significantly more likely than younger seniors to choose the plan that their actual broker or agent recommends. So the good news is we found that most seniors do find their best fit plan. In fact, year over year, 67% said they do. And in 2022, 67%, well, like I said, it consistently said they found their best fit plan. And how long does it take for them to find the right plan? 44% said it took less than an hour to find and enroll in a plan. 28% said it took 1 to 2 hours, and 19% said it took them more than 3 hours to find and enroll in the right plan. What did seniors say are the factors that make the plan they selected the best fit for them? Well, the plan with the lowest total out-of-pocket costs and zero premium, which we talked about, came in neck and neck as the top reason for nearly 40% of the seniors. This closely followed by 36% who said the plan they selected had the best supplemental benefits. Again, followed very closely at 35% of those who said that they said it was the plan with the lowest drug costs, and 21% said selected the plan that their broker or their agent recommended. We also took a look at how seniors completed an enrollment, how they interacted with agents, and their opinion on interacting with agents virtually, which is obviously becoming more and more popular. Agents actually help 40% of seniors with enrollment, and 53% of engagement takes place now over the phone. 20% used email to connect with agents, and only 14% met in person. That's, obviously changed quite a bit since COVID. Very few used text or online chat to connect to their agent. And when asked if they thought interacting with their agents virtually was helpful, 29% said it actually was not helpful. But 17% said it was, and 54% said it was as helpful or even more helpful than meeting with their agent in person. So moving to digital engagement is certainly on the rise. Year over year, seniors are actually satisfied with their Medicare plan shopping experience. And last year, we saw that it was the older seniors who were most satisfied. Overall, 70% of seniors were either satisfied or very satisfied with their experience, and only 20% remained neutral or what we would consider very few were dissatisfied. Why they stay with a carrier, that's super important. 61% of seniors trust their carrier and have been very happy with them. Trust in the brand far outweighed the other factors as to why seniors stayed. And only 14% with their plan after shopping around. Only 14%, stayed with their plan after shopping around, and 8% stayed because their doctors are on the plan. So brand trust as the reason for staying with a particular carrier holds true year over year. For those that actually switch carriers, that was 43% of seniors last year. The reasons were very varied. 23% said their broker guided them to a better fit plan. 21% wanted more supplemental benefits, which we're seeing more and more, up 13% over the prior year. 14% actually found a less expensive plan with another carrier, and 14% were not happy with their plan coverage or carrier. 5% had to switch because their plan was no longer available in the coming year. So to summarize the key findings of the survey, the journey, most shop online or through an agent. The enrollment process, in average, takes about an hour, and most seniors are satisfied with their shopping experience. The factors most important to seniors when choosing a plan costs, including lowest out-of-pocket or zero premium. Older seniors say a plan is a good fit when they can keep their current doctors, and they want access to supplemental benefits. The role of agent in plan selection, it's high. 1/3 of seniors rely on agents for trusted advice on plan options. 40% of seniors use agents to enroll, and 25% give credit where credit is due to their agent for helping them find a better fit plan. And now I'm going to turn it back over to Kara to wrap things up.
Great, Susan. Lots of data there, but great information to have. Thank you. To sum things up, we'd like to leave you with a visual of the solutions we offer to help ensure an optimal member experience that can help reduce plan disenrollment and lead to higher star ratings. These are our solutions for each stage of the member journey to help you acquire, engage, and retain members. I wanted to call out our new value-based care program. We offer value-based care education and an advanced provider search on our Plan Compare One platform to connect agents to seniors and seniors to providers in order to help improve health outcomes and make sure seniors are getting the care they deserve. We thank you for your time today and invite you to learn more about our solutions, team, mission, and how you can become part of the ConnectureDRX family. You will receive a recording of this webinar and a follow-up email. If you have any questions at all, please visit our website or email marketing@connecture.com. We certainly look forward to having you on a future webinar. Thank you.